Hey, good afternoon, everyone. Good afternoon. How you doing? We are back. We are back. This is your guy, Mark Calhoun. I am the director of social and community services of CareSouth, South Carolina, with my partner in crime.
My name is Daniel Myers. I'm director of MAT-SUD services right here at CareSouth, South Carolina, and glad to see everybody. Glad to be back on the air. Glad to be back. Yeah.
Absolutely. And this is the CareSouth South Carolina Community Live podcast. We have a special guest in the building today.
Yeah.
We do. Yes, we do. So we're going to be quiet like we normally do, and we like our guests to introduce themselves. So we're going to fall back and we're going to give you the floor, Doc.
Hey, great. Thank you so much. And thank you so much for inviting me to do this. My name is Jane Kelly. I'm the South Carolina DHEC Assistant State Epidemiologist. And I'm relatively new to this job. I started in September, but I'm not new to South Carolina. I'm not new to public health. I've been working in a lot of different settings, did my original internal medicine residency here in the great state of South Carolina at the Medical University of South Carolina in Charleston. And then I've worked in a bunch of places around the country, worked at CDC, Centers for Disease Control and Prevention, but South Carolina has called me back. So I'm glad to be back living in Charleston.
We're glad to have you.
Yes, we are. Very much glad to have you, Doc. So the reason we wanted to do this podcast today is because we wanted to make sure that everyone has the information on the vaccine that's been at least the two vaccines that's been approved that are being in the process of being approved. I think one was approved this morning or yesterday.
Yep.
But we wanted to make sure our audience, our community, our patients, our staff get all of the latest information. And so we'll have that information and be able to make that informed decision on whether or not, we want to take the vaccine or not. So.
Absolutely. I prepared some slides and, if it's okay, I'll show a couple of visuals, but I know probably the most important thing is having enough time to answer questions. But if it's okay with you, I'm going to share my screen and show a couple of slides. Hang on for a minute. So there we go. Can you see my screen? Can you see my slides?
There you go.
Yes.
All right. So here are a couple of things that I'm going to talk about. I think the number one question I keep getting is how could these vaccines be created so quickly? Is that safe if you develop them so fast? How is this possible? And how do they work? And what can I expect in terms of side effects? And I do want to kind of set the stage a little bit also with just talking about some basic, I don't want to get too far in the weeds, but some basic things, because you hear these words thrown around, I want to make sure people know what they mean. That word coronavirus, that's like a group of viruses, and they get that name because of the way the virus looks under the microscope. So SARS-CoV-2 is the name of the virus. And the disease it causes is coronavirus disease 19, COVID-19. And the 19 is not because there are 19 COVIDs out there. It's because it was first appeared on the scene in China in 2019. And the picture, the little drawing I got there of the virus, I wanted to show that because everybody's talking about these new vaccines that focus on something called the spike protein. So this virus has a string. It sort of looks like a worm curling around in the center. That is made of RNA. RNA is genetic code. It's like the instructions from that virus to make more virus. And then sticking out in a bunch of little spikes on the surface is a protein called the spike protein. That acts like a lock-in key, that spike protein attaches to a cell and opens the cell up to let the virus in. So again, not to get too complicated, but just so with this visual, you can see that spike protein in the upper left-hand corner, it's attaching to the cell surface, the virus gets in the cell, and then it uses all your cellular parts. It hijacks them, take over to make, instead of your normal body proteins, it makes these new virus proteins and then releases all those viruses. So let's talk a little bit about vaccine. A vaccine is almost like a sneak preview for the body. So in this cartoon, I've got a picture with a wanted poster of a virus, and those green guys are supposed to be the coronaviruses that are looking worried because those white things are the white blood cells and the antibodies that are going to attack the virus. And because they had that sneak preview by the vaccine, they're able to jump on the infection immediately. There are a lot of different types of vaccines. You've probably heard about other vaccines, like one of the oldest ones is the polio vaccine. You may have, as a kid, gotten either the oral polio or the polio shot. There are a lot of different kinds of vaccines, but this one coming up, this Pfizer vaccine that was just approved, and the Moderna vaccine that will probably be approved next week, are based on this RNA business. This is the last time I'm going to show a real technical slide, so hang in there. The whole idea of this is it's important for people to understand you cannot get COVID-19 from the vaccine. This is not a vaccine where you take like the virus and weaken it and then inject it. It only has this little snippet of instructions to just make that spike protein. It just has that gene for the spike protein, and then it's coated with some oil and protein so that to keep the RNA from breaking down. And that's what the vaccine is. The vaccine gets delivered as a shot into your arm muscle. This is not one that has to be delivered in the butt. This is a shot in your arm muscle. The vaccine just contains those instructions for making those little spike proteins. And then when your cell does that, releases them into the bloodstream, you see those little green things in the lower right-hand corner. Those are antibodies. Your body responds by making antibodies. So if you are exposed to the virus, those antibodies will attack that spike protein right away, and it'll never have a chance to even get into your cells. All right, let's talk about developing vaccines in record time. This little slide I copied from the New York Times and from an article talking about how long does making a vaccine really take. And I like this visual for a couple of reasons. First, what I'd like you to do is just focus on the gray bars. Those gray bars are how usually a vaccine is made. And I want you to notice which ones are the longest bars. Well, building factories is the longest bar. And then preclinical, like before you do any studies in humans, that's a long bar. And academic research, that's a long bar. In fact, the human studies parts, the phase 1, 2, and 3 trials, which I'll talk about in a second, those aren't all that long. The longest part of making a vaccine is the basic science stuff, figuring things out about a virus or a bacteria. And some of you may remember SARS back in 2002, severe acute respiratory syndrome. It infected about 8,000 people, started in China, just like this SARS-CoV-2. Genetically, it's very closely related to this virus that causes COVID-19. And so research that was done back starting in 2002, starting 17 years ago, helped us with building a vaccine for SARS-CoV-2 today, because they're very closely related. This basic science research has been going on for 17 years. That's like one of the longest steps. It has been going on. They started work on a vaccine then, and when the original SARS was contained, they just never finished making the vaccine. But we had all that stuff to basic science to work on. Now I'd like you to look at the blue bars on there. That's what has happened with the SARS-CoV-2 vaccine development. That academic research went all the way back to 2002. It started a long time ago. But all those other blue bars, you'll notice they're overlapping. Usually vaccine companies, they don't want to build factories until they know they've got a sure thing. But because it was so urgent around getting a vaccine out, they started building factories and working on manufacturing right from the very beginning. These phases are overlapping. So no steps have been skipped in making this vaccine and in studying that vaccine. Let me take you a little step further. So how do we know that vaccine trials demonstrate safety? How do we know a vaccine is safe? Now here I'm going to show 3 different phases. This is the times where you're testing them in humans. Of course, before all this, they tested it in animals, they tested it in mice, they tested it in monkeys. But this, I'm just going to focus on the human testing. Phase 1, and this started back in June, phase 1, they tested normally in just a small number of people. For the Pfizer vaccine, the one that just got approved, and for the Moderna one that's coming up, they tested it in about 100 people each. And when just looking in normal, healthy people, no medical concerns, young, healthy people, did anybody have a bad reaction? No bad reactions? Great. They go to the next step, phase 2, where they tested it about 500 people each. And then again, they're looking for safety, but now they're starting to try and figure out what's the best dose. And once they've got that figured out, then they've tested it in more than 30,000 people. I mean 30,000 in both the Pfizer and 30,000 in Moderna. So this vaccine has been tested already in more than 60,000 people. They look for any serious side effects, but they also look to see whether the vaccine works. Now, that sort of safety study doesn't stop there. What about long-term or rare side effects? What about that 1 in a million side effects? Well, we're not going to know about that until that vaccine is given to more than 1 million people. So yes, there are still some unknowns, but that would be true with any vaccine. I mean, you may have heard about in England, they've already approved the Pfizer vaccine. And in the first week of giving it out, that there were 2 people who had a bad allergic reaction to the vaccine. Well, that can happen with any vaccine. Turns out those 2 people had serious allergic reactions to other vaccines in the past. So probably was not a great idea to be vaccinating them with this. But what we do know is that of those 60,000 people who've already been tested, not a single one of them had that allergic reaction. So that's a rare reaction. It's always possible. Anytime you're talking about a vaccine, you have to make a personal decision, just like you make a personal decision to, drive your car or, go do something that might have some risks to it. You make a decision of what your benefit is versus your risk. And that's true for this as well. Each of us has to, get the information that's important to you and think about what's the benefit of the vaccine. And we know from these studies that these vaccines were proven to be 95% effective, meaning nothing in life is 100%. There were a couple of people who got vaccine who still got COVID-19, but they got a much milder form of COVID-19. So you have to weigh the benefit of the vaccine with, there are going to be some symptoms getting a vaccine, and then there's always the question of the unknown. So let's talk a little bit about weighing your risk. This slide with COVID-19 at the very top, do you know that this past week in South Carolina, the #1 cause of death was COVID-19, greater number of people than died of heart disease, that died of cancer, that died of stroke. #1 cause of death is COVID-19. And it's not an equal opportunity disease. If you look at death rates, but African Americans, Latinos, American Indian, Alaska Natives are more than 3 times as likely to die of COVID-19 than white Americans. Now, there's no biological reason for that. That has to do with access to care, with diabetes, with other medical conditions, but that's a really eye-opening statistic. It's also true that people have more risk of having severe disease if they've got certain medical conditions, like I mentioned diabetes, but also chronic kidney disease, obesity, high blood pressure. People who have those other medical conditions, they're more susceptible and they get worse COVID-19 and a higher risk of being in the hospital or unfortunately of dying of COVID-19 if they catch it. I want to talk up front about what some awful things that have happened in the past and what things have been put in place to try and prevent them, because I think we need to be honest about this. I'm talking about the Tuskegee trials. There are a lot of historical events that I think African Americans have good reason to have medical mistrust and not trust vaccines. They feel like they don't want to be guinea pigs. There's lots of reasons why I can understand that to be true, but I do want to mention some things that have been put in place that make this vaccine different from the Tuskegee trial. The Tuskegee study studied African-American men who were infected with syphilis and followed them for years to see how that disease was going to affect them. Well, it was one thing when they started the study. The awful thing is when penicillin was discovered to be a cure for syphilis, that those men were not offered penicillin. That's unethical. That never should have happened. What has happened is, what systems have been set in place to prevent that from happening again. There's a whole list of them going on there. Institutional review boards, guidelines on ethics. Anytime a vaccine manufacturer, a company, a college or university, or CDC or FDA, any of them are trying to do any studies involving humans, they have to go through a lengthy process to get it approved. And it's a process that continues to go on. And that was in place for these vaccines as well. Now I'm going to talk a little bit about the vaccines. I mentioned there are two companies, Pfizer and Moderna. Their vaccines are very similar. There are a couple of differences between the two of them that have mostly to do with logistics, like how the Pfizer vaccine has to be kept in this super cold freezer. But for people receiving the vaccine, they're really pretty similar. They're 95% effective after 2 doses. So you do need 1 dose and then a booster. And they do have some mild to moderate symptoms after that second dose. People get a sore arm. They might have fatigue or aching all over, but this is not a permanent deal. This is, some symptoms after vaccination that I feel like we need to warn people about up front so that they know to expect it. That there were no serious bad effects, like nothing that drove people to visit the emergency room or something like that. But I think people need to know up front that more than half of people reported in that vaccine phase 3 study that they had mild to moderate fatigue, chills, headache, muscle aches after that second dose, or pain in the arm after that second dose. But it's temporary. It lasted 24 to 48 hours. I want to make sure people know about that and know about these are temporary symptoms, and they are a sign that the vaccine is working. It's a sign your immune system is responding. And, I think about this in terms of like the shingles vaccine. There are 2 shingles vaccines out there. The old shingles vaccine causes fewer symptoms, but it only worked half the time. It was only 51% effective. The new shingles vaccine is 97% effective. But I'll tell you what, I had that shingles vaccine and, I had sore muscles and fatigue, didn't feel great the next day. But it's worth it to me rather than to risk getting shingles. So everybody's got to make their own decision. Nobody's going to force anyone or require vaccination. But I think it's something to think about. What is your personal risk? What would happen to you if you caught COVID-19 versus, your willingness to accept the vaccine? Now I'm gonna stop sharing that screen for just now because I want to show you something different. Trying to exit out of that and open a different one. Sorry, maybe we should take some questions before I show anything further. What do you all think?
That sounds good.
Yeah, if you got any questions,
I've got some more things I'd like to show you, but I don't want to bore you with PowerPoint slides.
Yes, okay.
No, this is good information, real good information. But if anybody is watching, if you got any questions about anything that she said or any questions in general, now is a good time to go ahead and ask those. We can see your questions, so just go ahead and post it, and we'll make sure we reach out to her.
So while we wait there, I have a question. For someone that has already tested positive for COVID-19, or someone that is currently positive, what is the recommendation for them to take? When is the best time for them to take that vaccine if they're going to take it?
Sure. So let's start with the first question, just about if I had COVID-19, do I need to get vaccinated? It is recommended that you get vaccinated, even if you had previous infection with COVID-19. And the reason for that is when they measured antibody levels in people who've had COVID-19 versus antibody levels in people who get the vaccine actually gives you better antibodies than having the disease itself. So it is recommended if you've had COVID-19 that you get the vaccine. Exactly when is not, I'm waiting. I know the vaccine has been approved, but there's also another group that is meeting today and tomorrow to give some further recommendations. So I want to hear what their recommendations are, but I would suggest that it would be best to get it after 90 days after you've had the COVID-19. And the reason I say 90 days is because we know antibodies last on average in people who've been infected at least 90 days. You certainly don't want to get the vaccine if you are currently sick with COVID-19. You want to wait until you recover. And if you've been infected, you probably should wait 90 days before you get the vaccine.
So we got several questions. One on the screen right now is, what's the possibility of getting it even if you took the vaccine?
That's a good question. And it looks like there's a 5% chance that you could still get infected. That's what those studies have shown. That was 95% effective. But I'll tell you, as a vaccine, 95% is about as good as it gets. And that's really high. And I was showing, I think you can see my slide now. I was trying to show, who all was studied in these phase 3 trials, because some vaccines don't take as well in some people who, for example, are over a certain age. The Pfizer and Moderna vaccine are surprising in that they did these studies in, not just in the United States, they did it in a bunch of other countries as well. And they enrolled people from lots of different racial and ethnic backgrounds. And so, for example, in the United States, about 10% of people who were in the vaccine trials were African American, 13% were Hispanic Latino, 1% Native American, and they also studied it in older adults up to age 85. And the really amazing thing is that this vaccine was 95% effective in all of these groups. So it wasn't just effective in young, healthy people. It was effective in everybody. So yes, there's still a 5% chance you get that vaccine that you could still get COVID-19. But it is also likely, if you get it, that you will get less severe disease.
Okay. So, Joy, somebody want to ask a question. Would you be taking the vaccine when it comes out?
Yes, ma'am. Or yes, sir, whoever just asked that question, yes. Okay. I have to respect the system, though, that we know that we're not going to all have enough vaccine available to vaccinate everybody up front. And I can telework, so I should not be at the front of the line. The people who should be at the front of the line are the people who are taking care of patients with COVID-19 right now, because they are exposed, and also because if they're out of work because they are infected and they need to isolate, then who's going to be taking care of those patients? And once we get those healthcare workers vaccinated, as well as people who are in nursing homes because they're highly vulnerable, we'll start offering vaccine to people who are either older adults or who have those medical conditions I was mentioning that place them at higher risk, like diabetes, heart disease, liver disease, kidney disease. And we've got a list of those medical conditions that we would recommend people receive vaccine. But we know it's going to be a couple of months before we have enough vaccine available to offer it to everybody who wants vaccine. I mean, our goal, we will have vaccine available so that everyone who wants vaccine can get vaccinated, but just not all at once. It's just, we're going to have to roll this out over phases.
Well, Dr. Kelly, I'm sorry, Marie, go ahead. I'm sorry, go ahead.
Oh, no, I was going to say, just for the record, that's a yes for me as well.
So Marek is taking it. So before we get to Mr. Lightfoot, Mr. Toya McGuinn had a question. She said, there's no evidence that this virus can't be caught more than once. And there are a few proven cases of people being infected more than once. So if catching doesn't provide immunity, then how would a vaccine provide that immunity?
Sure. And that's a really insightful question. You are hit the nail on the head that there are some challenges here. There have been people who have been infected twice with COVID-19. It's been rare, to have get infected a second time. And it implies that they did not have a good immune response to that first time. That may be true with this vaccine too. There may be people, we know that there will be people that this vaccine will not take in. That's what we found in those studies. Just like, the flu vaccine every year, sometimes it's only 60% effective, sometimes only 50% effective because it doesn't work in everybody. So I got to be honest up front about this as well. This vaccine is not going to work in everybody, but so far it looks like it has worked in 95% of people who have taken it.
So you're saying you said that 5% includes those people who didn't develop the immunity through the vaccine. That's including that 5%.
That's right.
Okay.
And, as time goes on, of course, once millions of people have received this vaccine, we'll have that much more information. What about people who have, for example, an autoimmune disease like rheumatoid arthritis or lupus? Do we know how well that vaccine will work in them? We've got no reason to think it will cause any harm, but we don't know whether it work as well in them as some other people. We do know that it worked well in people of diverse racial and ethnic backgrounds. We know that it worked equally well in people who had, I think, do I have that slide? Yeah, here we go. This is the Moderna vaccine, but there was a very similar result with the Pfizer vaccine as well. You can see that they had about, in that phase 3 study, where you have more than 30,000 people enrolled, 36% of them had diabetes. 25% were severely obese. 19% had significant heart disease. 18% had lung disease. So we know the vaccine worked, including in these people with these medical conditions. I hope that answers your question.
Yes. So, Mr. Lightfoot want to know, so when would a vaccine be ready for the general public? I think you answered that somewhat, but could you just just say it again, let everybody know exactly when they can expect to be open to the public?
Sure. And I can't give you an exact calendar date because it depends upon supply and demand. So here's what we know thus far. And of course, anything I say, is subject to change. But right now, what we understand in South Carolina is that we're going to receive by the end of the year, by the end of this month, about 200 to 300,000 doses of vaccine. So we would be able to give at least that first dose of vaccine to 200 to 300,000 people. Our goal here is trying to minimize death. So that first vaccine is going to go to healthcare workers in healthcare settings. And I don't mean just doctors and nurses. I mean the nurses' aides. I mean the respiratory therapists, the radiology technician who's going into the intensive care unit, taking x-rays, anybody who is working directly with COVID-19 patients in a healthcare setting. But also nursing home, assisted living, people living, older people living in congregate settings, because that's where we've been having the greatest mortality. The highest death rates have been in those nursing homes. So they are first on the list. We anticipate that we also want to get all the other healthcare providers who are, seeing people who are sick. It might be in, urgent care setting or doctor's offices who are seeing people who are sick with, and also EMS, first, fire, firemen, first responders, who are seeing people who have suspected, possible or confirmed COVID-19. Got to get those people all protected. How quickly will we get more vaccine? We have been told that, and I'm keeping my fingers crossed that Moderna will be approved as well, because the more vaccine, the faster we can start rolling it out. And I think it will be approved. This first month, we're going to have to be focused on workers in healthcare settings and long-term care facilities. Starting in early 2021, we will be getting weekly doses of vaccine will be sent to us. And as the more we get, the more we can start opening it up to other people. So I'm sorry, I can't give you calendar dates. It sort of depends upon how much we get, the supply, but also demand. I mean, I know that there will be some people who say, I'm not going to get vaccinated. And that's their right. That's their decision. So, depending upon how much we get and how much uptake it is, we'll then be starting to move into offering it to people who are at highest risk because of medical conditions, or because of their age, and then or people living in other congregate settings, for example, in prisons. The people in prisons are at increased risk. We have had COVID-19 outbreaks in more than half the prisons in South Carolina. So we want to make sure people who work and people who are incarcerated are also vaccinated. That they are at a risk that they can't control. We also want to make sure that we are vaccinating school teachers, people who are working, in essential services. But defining that and rolling that out is going to take time. So before, we got to get those folks, offer those folks vaccine before we have it open to the general public, meaning people who are, young, healthy, don't have any medical conditions, don't have some work site situation where they can't protect themselves. I think about people, for example, in meatpacking industries. It is very difficult to stay distant in those factories. You're working close to people, and we've had a lot of outbreaks nationwide in those sorts of facilities. So, those folks are high priority for vaccine as well. So sorry to not be able to give you a calendar date. I mean, 2021 vaccine is coming, but it's going to depend upon supply and demand.
Absolutely.
So,
right after you read it. Go ahead.
I'm sorry. We have another question. I'm gonna just look both of hers together. She said, right after you receive the vaccine, would you be contagious? And also, she has a mother that's 97 years old. Would it be advised for her to receive this vaccine? And she said that she's very healthy.
Okay. As people, let me take them in reverse order. One of the things that was I was really glad to see with this COVID-19 vaccine is that they vaccinated people up to age 85 in their study, and there were no bad reactions. There were no serious reactions, even in the elderly. And that it was 95% effective even in the elderly. Now, granted, they only went up to age 85. Your immune system starts to wane. You get less immune response the older you get. So yeah, we would recommend it for your 97-year-old mother. If she's not living in a nursing home, she's not, in this very initial phase, but she would be, as soon as we get those folks covered, she would be in the next phase of vaccine rollout. And with regards to your question, if you get the vaccine, are you contagious? No. This is very different from some other vaccines. I want to be really clear on this. There have been some other vaccines like, polio vaccine where you can be, or some live virus vaccines where if you get vaccinated, yes, you're protected. But let's say you're living with somebody who's got HIV, or they're on cancer chemotherapy, and you got to make sure that, you don't transmit disease to them, that you cannot get COVID-19 from this vaccine. It is only giving that little snippet, that little tiny piece of genetic code for that spike protein. So you cannot get the virus from this, and you cannot be contagious. You can't transmit disease.
Wonderful. I got a question too that I know I hear a lot. A statement that I hear a lot, and maybe you can clear this up. A lot of people are thinking that this is a made up thing, that this COVID-19 is made up. It's not real. This is the government way of controlling us, and just want to see if they can put chips in us and everything else. This is, there's a lot of conspiracy theory behind the virus itself, and then also the vaccine. So can you kind of clarify that and just dispel those myths that people might have?
I can, but I think everybody's got to seek out their information themselves, also. And a word to that, because especially now with social media, there's so much information out there. It's hard to tell what's true and what's not, and so there are a couple of tricks for trying to seek out whether you trust the information. One is to, if somebody makes a claim, they better be able to back it up. They better, don't just make a claim and not show me the data. Show me, give me the website where you got that. But for me, I want to see a scientific paper about that. And so I would say the same thing to you, even if you feel like, well, I don't know that I'm going to be able to understand this detailed scientific technical paper. What I want to know is, does that paper exist? Where are you getting this idea that, show me the data. And if all they can show me is somebody else's Facebook posting, that's not good enough. I want to know where the study was done. I want to know, where this is published in a journal article, not somebody's newsletter. And if they can't show me that, then I'm skeptical. I think it's good to be skeptical and to and seek out your own information. What I can say about, is this disease real or not? There are thousands and thousands of peer-reviewed journal publications about this disease. So if this is a conspiracy including millions and millions of scientists around the world.
Exactly.
I don't know what to say about that. I mean, when I talk about scientific journal articles, these are like, if you want to get something published in Nature, the New England Journal of Medicine, Science, the Lancet, you write your article, you send it in, and then you get a group of people who are experts in whatever that field is. If you're, working on molecular biology or lung disease, they get experts to review your paper, and they come back to you with a bunch of questions. They want to basically see your notebooks. They want to, make sure you're not making up the data. And there have been whistleblowers, right? There have been times where paper is published and then somebody says, wait a minute, this data doesn't make sense, and they have to pull it back. So there's a process in place for doing that. But there have been tens of thousands, if not hundreds of thousands of articles about this virus on different aspects of this virus. I know that's hard, sounds hard to believe, but it's because this has been such an urgent need.
Right.
So I hope that gets people thinking about, where are your trusted sources of information and what to do if you hear something that you're not, that you wonder about. Mm-hmm. I see the next question. I may have missed this, but what about children receiving the vaccine? It's not approved for children yet. The phase 3 studies were all done in adults age 18 and over. They are only starting the phase 3 studies in children now. So it's going to be a few months before we have the results from that. You've got to recruit, again, thousands of children. And then after you administer the vaccine, you give one shot and then a booster, either depending upon the vaccine, 3 or 4 weeks later. And then you want to wait 2 months after that to make sure that there weren't any side effects, that come up during that period of time. So unfortunately, it's going to be months before it's available for children. I know the FDA approval for the Pfizer vaccine, they approved it down to age 16. So, but not younger than that. Kids are not just small adults. They've got, developmental things. We've got to make sure the vaccine is safe for them.
Okay. But Marek, I got another question. So the efficacy of wearing masks. What mask should we wear? Is it important that we wear masks? And the neck gaiters or the cloth mask. Mm-hmm. What is the best protection to wear during this time? There's a lot of things out there, and we want to make sure people are wearing the what's going to protect them the most. Not that looks the best, because fashion. I don't care about fashion. I care about health. Okay, so what works best?
Can you keep people entertained? And I'll come back with a mask in a moment.
Yes, ma'am. Yeah, and that's an important question, Daniel, because I had got accustomed to wearing the waiter because it's one's comfortable, and it looked good. I mean, I'm being honest. I'm just being honest, but it's comfortable. But I was at work and someone gave me a shout out, Loretta, one of our RNs at CareSouth. She showed a little trick about to determine if if your mask is actually suitable. And she lit her lighter, and she said, "Put your waiter on like you normally do." I tried to double fold it. She said, "No, I'll put it on like you normally do." So I put it on, and she said, "Blow," and that flame went out just like that, right? And she was like, "You don't have enough layers, bro. You don't
That's a
have, you
good.
don't have enough layers." And ever since that day, I put my waiter away, and started wearing the proper mask.
Yeah.
That's a good trick. Now, I know CDC just recently came out with the statement that gaiters are okay and wearing a neck gaiter, but there's a clarification to that, right? I'm just going to demonstrate I'm wearing a turtleneck here. This is not adequate. This is a single layer. I could blow out that lighter or that match easily through this single layer. It's got to be at least 2 layers. So I have a mask here. My mask actually is 2 different kinds of cloth. So having 2 different types of materials also helpful, like cotton and silk, or cotton and nylon. So two different kinds of cloth. And my mask also has this little space here where you can put in a filter or a little additional material if you want to be super duper safe. It's important you need to be able to breathe through your mask, but having I don't know if you can really see, if I can show this, the inside of my mask, I've got kind of like fuzzy stuff.
Yes.
Yeah.
So it's literally you can take the cotton batting that you might use in quilting, because it is not just a matter of physically capturing droplets. That's part of it, but it creates sort of an electrostatic trap. By that, I mean, you've probably all had the experience of walking across a carpet, like in the dry winter, and then you touch something metal and you get that shock. The idea behind that is that you create a little electric barrier in there as well. Seriously, with this sort of fuzzy stuff. And the virus sticks to that. So what are the important principles around a mask? My mask has a little metal thing inserted, but you can also buy little metal pieces that you can glue on the outside. I mean, you can Google that, go to Amazon. We bought a bunch of them because you want it to fit tightly over your nose. And I like this mask because it's got adjustable ear things. So you can adjust the length of it, because my face is not the same as my son's face. So we need to have masks that you can adjust. So I can adjust these ear tabs so that, because I don't want a big gap. I don't want this big gap here. I want to adjust my ear tags, my ear loops, so that it fits snugly. So now it is over my nose. Excuse me, I think I tightened that one too much.
Yeah, off a little to the left.
Well, you get the idea. So over my nose, I can bend it so that it fits my nose, goes under my chin. So I've got both my mouth and my nose covered. Sorry, I'm a little crooked here today, but I think you get the idea.
Yes, ma'am.
I don't want to promote one mask manufacturer over another, but I think these are the features to look for. And if you get a mask that does not fit properly, it's almost like not wearing a mask at all. That you're not protecting yourself and you're not protecting others. You're fooling yourself. If you're wearing a mask that's only covering your mouth and it's below your nose, it's like wearing no mask at all. Will mask wearing be advised after vaccine? Yes. So it's great that the vaccine is 95%, but that means that 5% of people are not protected when they receive the vaccine, and you won't know if you're one of them. So let's say you get the vaccine and you think you're protected, but you're that 5 in 100 persons, that unlucky 5% that is not protected. So you, at least until we get most people vaccinated, so that there isn't so much virus circulating in the community, It's going to be important in the beginning. Keep following these same rules about wear your mask, keep your distance, don't go to large indoor gatherings.
Yeah.
And I thought I saw another question.
No.
Okay.
Well, one more question. The question of herd immunity, where you put a bunch of people in one place and you kind of give it to everybody, like chickenpox, right? When I was growing up, if one child in the community had chickenpox, the parents would take all the children to that house so all the children get chickenpox, and we're done with it, right?
Yeah.
So what about that same concept when it comes to this virus? Is that something that we hear a lot of talk about it? What should we think of that? What should we say about that?
The scary thing about trying to, because people have talked about, well, if I'm young and healthy, why don't we, all these young, healthy people, why don't we just all get together, sort of like the chickenpox party? Why don't we just all get together, get it over with, and now we're immune? And isn't that great? Wouldn't that be a service to society? The problem is none of us live in a bubble. That the young person has a grandmother, that young person has a friend who, has, they're on prednisone, they're, taking steroids for their asthma, and they're at increased risk. And that young, healthy person doesn't even know that they could transmit disease to somebody who would be more vulnerable. So when I talk about herd immunity, the best way to achieve herd immunity is through vaccine. And we're fortunate that we've got vaccine coming on the scene so quickly. And not just these two vaccines. There are several other vaccines that are in the pipeline that are in phase 3 studies right now that are looking good. I think we'll have more different people will have a choice. There'll be more different kinds of vaccine coming in 2021 also. But the only safe way to be achieving herd immunity without risking killing your grandmother is vaccine.
Yes, ma'am. Yes, ma'am. So I did have another question, Dr. Kelly. The surgical masks that you typically see in a healthcare setting, are they appropriate for wearing?
So the kind of like surgical masks, like the paper masks.
Yeah. They appear to be one layer, but I think generally they're three layers.
So the real surgical masks, because I think there are some kind of cheap mock-ups that aren't the real deal, and those cheap mock-ups that are just one layer, that's inadequate. Yeah. That really is inadequate protection. The real surgical masks, though, are not just paper. They might look like they are, but they've got that same kind of that baffle business on the inside, that I was trying to show here, that it creates an electrostatic charge to capture particles, and they are not reusable. You can't wash them and wear them again tomorrow. Whereas, this, I come home, first thing I do when I come home is I just wear this into the house and I drop it in the sink and wash it. You can't do that with a surgical mask. So yes, the real surgical masks, yes, you can use those, but the cloth masks you can reuse again and again by just washing them.
So the real surgical mask,
ignore that phone call for right now.
Not the one layer mask. The key to it is that inside layer backing.
Yes. Okay, Marek, I got one more question, and I promise, Dr. Kelly, I won't ask no more.
No, this is good.
The quarantining or quarantining guidelines. Can you explain the quarantining guidelines as it stands right now, from first, second, and third tier exposure?
Yes, and I did just see the question saying, so life won't go back to normal. Life will go back to normal. It's just going to take time. Life will go back to normal, but it's going to take time. Quarantine. So originally, what we knew about this virus is that people could if exposed to the virus, they could start showing symptoms as soon and be contagious as soon as 2 days after exposure or as late as 14 days after exposure. So originally we were saying you need to quarantine, meaning you've been exposed, you need to stay away from other people because you don't know if you've been infected and you don't want to, spread this further. We were originally saying you need to quarantine, stay away from everybody else for up to 14 days to make sure. Now that time has gone on and we've got a lot more information about this virus, we realize that, yeah, it's still true. Some people, it takes as long as 14 days before their test turns positive or they have symptoms. But really, those are very few. So the safest thing to do if you've been exposed is to quarantine for the full 14 days. But we realize that's hard on people. People need to go back to work, kids need to go back to school. That may be a really difficult burden. So on our website, the DHEC website, and on the CDC website, there's some other options around quarantine. Like if you have no symptoms and you get a test that's negative after day 5, then we recommend you could stop your quarantine at day 7. It's a little complicated to verbalize it because but it's clear on our website. So if you just Google DHEC COVID quarantine, it'll bring you to the spot where it says special options for quarantine. You can click on that link. And now we've got options for quarantining for just 7 days or 10 days instead of the full 14.
Okay. So what if just say if I'm the third person in this exposure, okay, you have an initial exposure, then you have somebody living in a house with that person, and then that person comes to me. Okay, how does that work with that quarantine? It does the same guidelines follow?
So we call that a contact of a contact. So let's say, I'll pick on my husband since he's walked through a couple of times. Let's say he is infected. What he should be doing is isolating. He should be, in the bedroom, separate bathroom, and we just stay physically apart. So I am, but let's say I didn't, in the beginning, we didn't know he was infected and I was a close contact with him. So now I need to quarantine. My son maybe just comes home from college, doesn't see dad, so he doesn't need to quarantine, and he can go out in the public. And so it has to do with how close you are in the chain. If you were a close contact to somebody who was infected, then you should quarantine. If you were a close contact to me during my quarantine, you don't need to do anything other than your usual be careful. Hope that wasn't too confusing.
No, that was perfect. Thank you so much.
All right, I see in the chat box, thank you. You may have convinced me to get the vaccine. So, if this call is well worth it to me, if I convince just one I don't want to say convince one person to get the vaccine. It's an individual choice. Look at the facts for yourself. But when I look at the facts for myself, my choice is pretty clear.
Yeah, same here.
I think you've given us enough information to make a more educated decision about taking this vaccine instead of taking some myths and a whole bunch of different things put together that's not true or partial truths. You've given us some factual information that we can focus on and that we can make an educated decision about getting this vaccine.
And more information will be coming, right? I mean, it's been licensed in England and here. So, we will soon have information on millions of people. I mentioned how many doses South Carolina is getting. The United States government has purchased 200 million doses of vaccine. So, in the coming months, the next month or two, we will have, millions of people vaccinated. So we'll know more about, are there any rare, 1 in a million side effects that we didn't know about? We'll have that information by the time it's being available to more general public.
So I lied, forgive me. The vaccines are free, am I right?
Vaccine is free, yes.
And so somebody asked me, well, if it's free, then does that mean we will pay later?
No, not sure if I understand that quite, but I mean, like that you'll be billed for it later or something.
Yes.
No. So the U.S. government has purchased vaccines. So they bought the vaccine, and then there's administrative costs. Like somebody's got to pay the nurse to be giving you that shot. That is covered if you have insurance. All the insurers, Medicare, Medicaid, Kaiser Family Foundation, Blue Cross Blue Shield, they've all agreed to pay for that cost. If you don't have insurance, HRSA is going to pay for the administrative costs. So there are no costs for this vaccine. I mean, no direct costs. What's the term that I want? You will not out of pocket. There will be no out of pocket costs.
Absolutely. Wow.
It was a great information. Thank you.
Great.
Thank you for all this. Yes.
Well, and more information will be rolling out. I mean, we've already had a lot of information come to the fore about this, and I know the next several weeks and months are going to be so much more. I'll be glad anytime you guys want me back. I'd be glad to come back.
Oh, thank you.
Absolutely. Thank you so much. Thank you. And I put in the chat box the website for DHEC is scdhec.gov /COVID-19 for more information there. And if you want any more information from CareSouth Carolina, you can reach us certainly at our website at www.caresouth-carolina.com. This has been certainly a wonderful discussion, some great questions from the audience, some great information from you, Dr. Kelly, and it's been a pleasure to meet you and to get that information from you. Just like Joy said, the information that's been provided to me allowed me to have an informed discussion with my little small family here, and we've all decided that we're going to take it based on the information and not what we keep hearing on social media and the innuendo. So thank you for that information on behalf of my family.
And talk to your doctor, talk to your pharmacist, talk to your community health worker. I mean, these are all, they've got information too.
Right.
Thank you so much. I'll be talking to my family about it whenever we get finished with this, and they're watching. And so, we're leaning in that direction too. I have my issues around vaccines based on history, but also I understand I need to do what's best for our community and for my family. So that takes precedence over any past thing that's happened. So thank you for informing me. Definitely.
All right. Any last words, Doc, you want to give us before we
thank you so much for this opportunity, because I think I know you're right. There are conspiracy theories, and there are some, there'll always be some anti-vaxxers, people who, no matter what you say, it doesn't matter. They're not going to change their minds. What worries me though are when rumors start and just, continue to roll, and that people don't have an opportunity to get their questions answered. So I would just encourage everybody, if you've got questions, you can email them to DHEC, and we'll try our best to answer them. Let us know if you're hearing these rumors. We've got to address these things. Word of mouth is so important. So I would encourage you to talk to your family members and friends and see what they're thinking. And then for me, when people ask me questions I don't know the answer, I don't want to make anything up or make up a guess. I want to say I don't know, and this is what I'm going to do to find out. So I hope everybody will take that message to heart as well. There are, we want to serve the public, and DHEC wants to serve the public. We want to hear your questions so that we can find out the answers for you.
Well, we got you on speed dial, Dr. Kelly. So we probably get in touch with you. Once everything get rolling and we get some more data in, we're probably getting you back on that back on the podcast so we can discuss the latest and greatest. So,
great.
Definitely.
Well, we do have one more question, Doc, and this is one question that we think is probably the most important question that we asked our guests when they come on. So what does Dr. Kelly like to do when she's not being Dr. Kelly?
I live at Folly Beach. I live at the beach.
Oh.
So I'm lucky. I'm lucky. I love the outdoors. I love walking, at the beach. I've got pets. I got 2 dogs, 2 cats, and 3 pet snakes. So I like my pets also.
Okay. I was a reptile guy too.
Really?
In my life,
Really? Usually I say that, people are like, ooh.
all pythons are Burmese pythons. That was me.
Yeah.
And I love to travel. I love to travel with my family, but boy, this has not been the year for any traveling. We are playing it safe. I mean, we just stay home. So.
All right. Well, we thank you for that. And again, thank you for joining us today. Like I said, if you want more information, you can reach out to DHEC at southcarolina.dheck.gov. You can reach out to us on our Facebook page or our website at www.caresouthcarolina-carolina.com. And if you need to get in contact with Dr. Kelly, you can reach us through that medium, and we can try to hook that information up for you and hook you up with her to get more information from her and some of her colleagues at DHEC. So again, thank you for joining us, Dr. Kelly, and we hope you have a wonderful weekend.
Thank you.
All right, everyone. Thank y'all. We're out.
Please, everybody. Wait a minute, Mark, before you close out. Everybody, we'll be back on at 2:00 today.
Yes, thank you.
We'll be back on at 2:00 with Dr. Duncan, discussing a transition from our EMR, so everybody know what to expect, what to look for on next week. Because next week is going to be a life-changing event for CareSouth, and we are excited, and we can't wait for the wonderful changes that's going to happen on next week. So tune in at 2:00 and see what we got coming up next. That's right, we got a 2 for today. We got a double hitter today. 2 for
2 wonderful doctors. Yes.
Yeah, there we go.
All right, y'all. So we'll see you again. We'll see you at 2:00, and everybody have a wonderful, wonderful, wonderful day and weekend.
Bye, everybody.